common is breast cancer?
So breast cancer is actually the most common of all female cancers worldwide and even in India. In fact, it is also the highest cause of cancer related mortality in India. So, in the Western countries, the lifetime risk of developing breast cancer is 1 in 8 women. And that ratio is slightly smaller here. It's 1 in 24 in urban India and 1 in 64 in rural India. So, there's a huge urban rural divide. And a lot of it has to do with the lifestyle factors, which we will come to. But even though we are 1 in 24, because our population is so large, the burden of breast cancer is still fairly large in India. The other thing that is important is the average age of developing breast cancer in the Western countries is 62 years, whereas in India it is 46 years. Now, it's not that people in India are getting cancer earlier for some
Yeah.
unknown reason, but mostly because our population is so young. Most of our population is less than 50 years of age. So the denominator is large, because of which the numbers are large.
That breast cancers are seen in men as well. Now, when I was promoting the event invite, I had a lot of people come back to me and say, "Oh my God, we don't know this." So, could you talk
Oh,
to us
yeah.
a little bit about that? Yeah, yeah,
Yeah, I mean, it just seems logical. Like, men don't have breasts, so how could they get breast cancer,
yeah.
isn't it? But however, 1 in 100 of all breast cancers, which means 1% of all breast cancers, occur in men. Because of this lack of awareness, like you mentioned, they don't recognize it. They don't know that they could possibly have a breast cancer. They think that it's just a small lump or it's just a wound, and they don't show it. So the numbers are, say, in the Western literature, it's 1 in 8 for women, so it's 1 in 880 for men. But still, the risk is there. This risk is increased if they have known genetic mutations like BRCA1 and BRCA2, especially BRCA2 individuals with BRCA2 mutation, men, they have almost a 5 to 10% risk of developing breast cancer in their lifetime. So men don't really need to do a self breast examination every month, but they need to know that breast cancer is something that they can also have.
So how
Yeah.
does one know that one has to now go to a doctor to show the doctor and diagnose themselves?
So, let me put it, one single, like a blanket umbrella rule is, anything new is suspicious.
Okay.
It doesn't matter what age you are, what gender you are. Anything new is suspicious. Other than that, the breast symptoms are mainly three. Usually, people have either a breast lump, or they have a nipple discharge, or they have pain in the breast. Okay, these are general breast symptoms which are there for even benign or even malignant diseases. So, what are suspicious for breast cancer specifically is definitely a lump in the breast, or even in the armpit or the neck. Okay, this lump is usually painless. Okay, which is why a lot of people actually come to us very late saying it was painless, so I didn't see the need to go to a doctor. So a painless lump is more suspicious than a painful lump. Let's remember
Yeah.
that. The other thing is that the lump is hard in consistency. And then there are also some skin changes that can happen. If you have very red, angry looking skin, which is not getting treated by a regular antibiotic course that your first physician, your general physician, or your gynac may be giving you, then that can also be a cancer hiding there. The other thing is an orange peel skin appearance that can be also a sign. So the other things for nipple is, there can be a nipple discharge, there can be pulling in or retraction of nipple, there can be scaling of nipple. So these are some of the main things that are there. So this is for localized breast cancer. Otherwise, for any sort of breast cancer, if it has spread, you can get generalized like body symptoms. Like you can have a lot of bony pain, weight loss, fatigue. uh, Let me not say fatigue here. I mean,
Yeah.
everyone's tired, but this I'm talking about, you lose appetite, you lose 5 kgs in a month without trying, all of that. So or a cough that is not so if breast cancer spreads to those specific organs, then you can get symptoms which are related to that organ.
Okay, so we want to ask, is a lump always a breast cancer?
No, okay. 8 out of 10, 80 to 85% of all lumps are benign. In fact, 80 to 85% of all breast symptoms are benign. So even a nipple discharge or a lump is most likely benign. There are so many causes of benign lumps, and there are many, many more, much more common than actually having cancer. So if you have a breast lump, come to the doctor, get it checked out. Most likely it's going to be nothing, but at least you will know that it is nothing. You will be more aware. You will be looking for signs for it changing or any other, you become more breast aware if you go to a breast doctor or any doctor and get your breast checked out, and be sure that it is benign before getting scared or thinking that it is 100% cancer.
Naturally, why is it so important to detect breast cancer so early?
So, detecting any cancer is early is very important. For breast, it has a twofold reason. Mainly, one is that obviously it has better survival. Okay, a person coming with a small lump, which is an operable breast cancer, has a 10-year survival of 85%, whereas someone coming with metastatic disease, which is disease that spread everywhere, has a 5-year survival of less than 50%. So that is one main thing, is that survival changes drastically based on your stage. The other thing is that if your lump is small and your mammogram or your imaging sort of allows it, your breast can be saved. So you have that option of actually conserving the organ. You know, the other day I was looking at my the pictures of some breast surgeries I'd done, and I was looking at it for another talk, giving examples of oncoplastic breast surgery, and I was looking at the breast and going, "Which one has been operated on?" So I was actually confused. So you can get really good cosmesis nowadays. So if you come early, you have a good cosmesis. You conserve your breast, you conserve your femininity, and you also have good survival. So it's so important to have early diagnosis and
Okay,
detection.
what should they do for the early diagnosis?
For early diagnosis, um, so breast cancer risk is quite different in women. So there are average risk women, which is most women in India are average risk women, unless you are a high risk woman. So let me talk to you about average risk women and screening for them. So screening nowadays, when you think screening, you think mammogram,
Yeah.
because that is how it is in the US, is that you have to come for your annual mammogram. But screening is so much more than that. Starting at the age of 20 or 25, you have to make a girl breast aware. She should know that these are the things that can happen. She should know what her normal is. That is so important, that even as a clinician, I will not be able to pick up something very, very small. We have had women come to us saying there's something, and it'll come out to be something zero point 0.5 centimeters, because they have been doing their breast exam and they know what their normal is and they know exactly how little even if it's changed. So getting back to it, starting at the age of 2025, you should know what symptoms it is you're looking for. You should do your self breast examination month after month. Even if you find nothing, you have to continue to do it. Then so 20 to 50 you sort of do this, and if you are just a very baseline risk, then at the age of 50 you can start sorry, you can start your mammogram every 2 years. Okay, so somewhere between the age of 30 and 35, you can also meet a breast specialist and have an annual clinical breast examination. So basically, there are three things in screening: one is self breast examination, one is clinical breast examination, and one is imaging, which is usually a mammogram.
Okay. And
So
self breast exam is something people have to start way early, which is say once they are in their
25,
20,
yes,
25.
yes.
Okay.
25 is a good age to start it. You know what is normal, and you do your self breast examination. You do it a week after your first day of period to within 10 days to it, because that is the time that the you can there's no engorgement. You know how in the premenopausal time
Yeah.
you have pain and tenderness and your breast might feel a little bit lumpy. All of
Right.
that is not there, so you're able to pick up and you're comfortable also while doing that exam.
You
So
know, what is the common age group that you normally see breast cancer in?
so
At least in India, if not.
yeah. So breast cancer is a disease of the old. Okay. Having said that, it is not impossible for women to get breast cancer at a younger age. In fact, I think in 2015, the youngest girl who was diagnosed with breast cancer was only 10 years old.
Oh,
She hadn't even
yeah.
developed a breast. So
Mm.
that's, I mean, really sad. But that's the thing, is that no one's really immune to it. So it should always be in the back of your head or your doctor's head, you know. So usually breast cancer risk, it increases up to your menopausal age. So by the time your menses stop, it increases your risk slowly. After 20 to 30 years of age, it keeps increasing, and then after you reach menopause, it kind of plateaus off. So that age when you're menopausal and perimenopausal, what we call, is the time where you have the highest numbers.
I was having a discussion with my non-medical friend, and she told me, "Oh my God, if we are diagnosed with breast cancer, that means we have to have a breast removal." So I wanted to talk a little more about that because
Yeah, of course.
it defines our femininity, and then women are really scared of that.
Definitely. So, one of the most important things for me, even within the medical fraternity, there is this thing. So, firstly, you can always conserve the breast. The main thing is early detection, and a mammogram should allow it. Sometimes you may feel that, oh, my lump is only this much, it's only 2 centimeters. But on a mammogram, that is why we always do a mammogram when a person comes to us first, is to see the main lump and to see if there's anything else that we are missing on palpation, which is on feeling the breast, on our clinical exam, if we are missing something. So if that allows, then we can save the breast and do something called as a breast conservation surgery, in which we remove the main lump with a surrounding margin of healthy tissue. That is extremely important. And we address the axilla, which is the armpit lymph nodes. They are the first regional node to which a breast cancer spreads, and you're not just treating the breast cancer by doing that surgery, but you are also sort of staging the cancer. You're checking if it has spread to the regional nodes or not. So a breast cancer surgery is not complete if the axilla or the armpit nodes have not been addressed. Um, so that is the other thing. Sometimes when you do have more than one lesion, if they're all in the same area, then you can go for something known as oncoplastic breast surgery. So this is a combination of two words, oncology and plastic surgery, in which you have, so onco always comes first. So you always get the lump, you get your healthy margin, you have to be oncologically safe first, and then you can do a small plastic surgery. Maybe you can move the breast tissue in that area, or flip something from a local a local flap into that area. And sometimes even if you need to remove the whole breast,
Mm.
you can reconstruct it with the lower abdominal fat is most likely, it is that it's always there, especially with the Indian body habitus. So
Yeah, yeah.
that can be used, or an implant based immediate reconstruction can be done. So so women don't miss their breast. They don't have that, I went
Yeah,
into surgery and wake up to that shock.
yeah,
Even if you're prepared for it, it's not a
yeah,
happy thing. So
yeah.
but overall, I would say the most important thing is what the patient wants. Like a 60-year-old may want to save the breast, but a 30-year-old, may want to get rid of it. So you have to always see what the patient wants, and there always has to be a dialogue, between a patient and the doctor, what the patient concerns are, what her wishes are, and based on that, we can mold our practice, definitely, because there is so much in our armamentarium now.
Yeah, medicine has advanced clearly, and there is a lot available now as compared to probably a decade back. So there is a
Yes.
question from one of our audience, and he asks whether lymph nodes detected for COTS get converted into malignancy. Under what circumstances does that happen?
So if you're talking about breast cancer, no, that doesn't happen. Basically, Cox lymph node is tuberculosis in the lymph node.
Tuberculosis. Yeah.
So, tuberculosis of the lymph node will not convert into a malignancy. That is not to a breast malignancy, definitely, that much I can say.
Since you also spoke about stages, can you also tell us, what are the different types of breast cancers that one can see?
So let me talk to you about stages first. So
Yes.
the first stage is stage 0. Okay, that is the best stage. That means that you've got the cancer very, very early. It's not even invaded the lining of the duct in which it is developing. So that is ductal carcinoma in situ. It is not invasion. So it is not cancer per se. It's a
Right.
pre-malignant lesion.
Right.
And and the survivals in this is extremely good. You have more than a 95% survival at 10 years. So that is your stage 0. When you talk about stage 1, it is usually tumors which are small. Either they are less than 2 centimeters, and lymph nodes are usually negative. Then you move to stage 3, where you have a slightly larger tumor size, maybe 2 to 5 centimeters, or even more than 5 centimeters, and the lymph node may be positive. And stage 3 also consists of patients who have you know uh, it's called locally advanced breast cancer. So it will be more of skin involvement. The nodes that are involved in the axilla, they will be bigger, they will be stuck to each other. And there may be also involvement of nodes in your neck or inside your chest, what next to the breastbone there are a few nodes called internal mammary lymph nodes. They may be involved. So all of these are regional nodes for the breast. So in stage 3, either the skin is involved or any of these regional nodes are involved. And then there is stage 4, in which the breast cancer has spread to outside the breast localization area. So it's gone out of the breast, it's gone out of the regional nodes. So most commonly breast cancer spreads to bones, liver, and lungs. And so once it spreads to that, that is called as metastatic breast cancer or stage 4 breast cancer.
Okay.
A lot of people
Yes.
get confused with stage and grade. So I want to dispel that fact a little bit. So stage is where your cancer's at, how much it's spread in your body or in the locoregional area. Whereas when you're talking about grade, you're talking about what the cancer is like inside the tumor. So how different is it from your normal breast cell, and how fast it's growing. So a grade 1 sorry, a grade 1 cancer would be a well differentiated, means that it is growing very fast, and
Okay. I think I lost you.
okay. I think Emma,
I think
you're
I,
stuck for me.
yeah,
Okay,
it got
yeah.
stuck. So you were saying
Oh,
grade,
it could be me also.
yeah,
Yeah, so grade 1 to grade
yeah.
3, grade 1 being the slowest growing and the most indolent sort of disease, and stage 3 being slightly faster growing. So, but the only thing I want to say in grade 3 is that don't be panicky if you see a grade 3, because almost 50 to 60% of the cancers that we detect here in India are grade 3. So, stage is more important than grade. Let me put it that way. So, if you catch it early, even a grade 3 behaves very well.
Okay. So the key is to catch a early.
Yeah.
Okay.
Sorry, what was the question? The risk
I think
factors
the
you were
risk
talking about.
factors, yeah.
Yeah. So, broadly, breast cancer risk factors are divided into two. One is non modifiable risk factors, and these are factors that can't be changed. Okay. So, let me give you an example. So, something like age or gender. So, female gender and increasing age are both risk factors for breast cancer. Sorry, let me just. So these are the two main risk factors for breast cancer. And the next thing that comes is family history and genetics. So you see, these are things you can't change. Then other thing is hormonal exposure. So this can be in the form of early onset of periods or late menopause. Okay. Then other things are there are some patients of childhood lymphoma who receive radiation to their body, and that increases their risk of developing breast cancer. So these are things that you can't change. The other thing that is also very important is having a dense breast on a mammogram. That also increases your risk of developing breast cancer. Uh, then we come to the modifiable, and this is, as the name suggests, it's factors that you can change, factors that you can work on. So the most I think the important, the most modifiable thing is a sedentary lifestyle and obesity, especially in postmenopausal women. So 3 hours of exercise a week is like magic. And just make sure that you don't put on any weight after your periods stop, because these two are very they are big risks for breast cancer. The other thing is hormone replacement therapy. So a lot of women post menopausal age, they start getting a lot of hot flashes and even vaginal dryness and things like that. So then they take hormone replacement therapy, and it was fairly, like, it was quite common earlier, but because of the breast cancer risk, it's reduced till now. So what I want to say is that in moderation, if you're having a lot of symptoms and you're not able to deal with it, then it's okay, take it for 6 months, take it for a year, but don't continue hormone replacement therapy, especially combination pill, for a long time. The other thing is oral contraceptive pills, which
Hmm.
is very rampant. So
Yeah.
oral contraceptive pills are also hormones which increase your risk for breast cancer. So I mean, take them. Contraception is important, but try to limit them, and don't take it for more than 5 years. I think 5 years is a good cutoff. The other very unfortunate thing is alcohol. So you shouldn't be drinking. I mean, daily drinking, of course, increases your risk, but even having 2 to 3 drinks a week actually increases your risk. But so I mean, everyone, you have a risk of everything. You live in
Yeah.
India, you have so much pollution, you have risk of everything. Currently everybody has the risk of contracting corona, but you go on living. So the main thing is that try to eat healthy, and try to do your exercise a little, limit your alcohol. And coming to hormones, just one quick thing is, I mean, if you can, you should try to have a baby before you're 30 years of age. And if you have a child, you should breastfeed the child for at least 6 months or preferably 1 year. So these are a few things that you can work around, few things you can change. I know, like, some things are, I mean, you may not have found your partner or are unable to breastfeed, and those things obviously you cannot change. But by and large, these are modifiable risk factors, and if you can, work on it, because it really reduces your risk.
Hmm. So, can you tell
Okay.
people how frequently they should do, how should they do it? Because I know people read it many times and probably see it diagrammatically, but
Hmm.
they are still a little hesitant to talk about it so openly.
Definitely. All right. So, self breast examination should begin at the age of 20 to 25. You should do it, as I said, after your periods, 1 week or 10 days after your first day of period. In women who have stopped their period, you can pick one day. I was born on 28th, so I will do it on every 28th. That will be like my monthly birthday gift. So,
No,
something
that's
like
sweet.
that.
Yeah.
Yeah. So, that. So, in a self breast examination, there are two main steps. One is inspection, which is looking. Let me say three main steps. First would be learning what you're looking for. Then you would look at your breasts, and then you palpate, which is you feel. So it is learn, look, feel. So learning is knowing what your symptoms, what symptoms of breast cancer can be, and we've talked about that. Your lump changes, skin, nipple retraction, or nipple discharge mainly, or something in the axilla or neck. So when you start your self breast examination, you start it in standing position. Sorry. So you start it in standing position in front of a mirror. Okay, so you stand with your arms by your side and you look at your breast. So you look at the shape of your breast, you look at your nipple level, are they both the same level? And then you put your hand on your waist. And then you see if there's been any change. Then you turn right, you turn left. When you're turning right and left, the main thing you're looking for is the shape of your breast. Is there fullness, or is there a flatness in your breast when you turn? Because then you'll be able to see the shape of your breast when you're turning in all
Right.
angles. Okay. After this, you take your hands up. You look how much your breasts are moving. Okay, whether one is moved more, mainly look at your nipples, if your nipples are moving the same, or if one is moving more than the other. Also, with your arm up, look in your armpit to see if there is swelling there. Okay, get your arms down, bend forward, and see the same thing. Is your breast moving the same? So always when you check a breast, one is in relation to the other. Okay.
Right.
So the first part, or the second part, if you say learn, look, feel, looking is done. Then you do feel. Now, feeling the breast, you always feel it with the opposite hand. So if I'm examining my left breast, I will do it with my right hand. You take your three fingers, and not from the tips, but from the pad of your three fingers, you firmly press the breast against your chest wall, and you do it in rotating movements, and you feel the whole breast. Now, there are sort of three ways of going about it. Either you go up and down, or you do it in wedges, like a pizza slice. So you
Yeah.
go out, out, in, out, out, in. Or you can even do it in concentric. So you go from out, 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 and you go in. Okay, after you're done examining your breast, you examine your armpit. So to examine your armpit, if you do this, it's difficult. So put your arm down, feel if you feel something, then feel your neck to see if you can feel anything. And after this, just once right at the end, express your nipple. Just press your nipple to see if there's a discharge. And pretty much this is the end of it. The another part of it is in the shower. You go and so when you're doing this touching your breast and feeling them, you should ideally do it in sitting position and in lying down position. And to do the standing position, you can do it in the shower, because once you put soap, your hands glide much more easily. You can feel if there's any bumps or lumps in your breast. So if that's clear. Otherwise, any points?
Yeah. No, thank you so much because it's important to talk about it. I know in Indian families, people don't really talk about this. I don't know how many mothers really go down and tell their daughters that, look, now you're
Yeah,
20 now,
but
you're not.
even even in schools, I think, or
Yeah.
colleges, we can sort of have a
Yeah.
program, like
Yeah.
health ed is not there in India,
Yeah.
so I
You're
think
right.
that is important. We should learn that as early as possible.
So thank you for that, and at least I am promising you that I will do it every month. And
Yay.
technically, yeah, all the girls who are watching this now and who will watch it later, all women out there should do it. It is about you first, and then the rest. So
Yes,
we have
always.
a question from the audience. Where Neeta is asking: is there a role of exercise for breast cancer risk reduction?
Yes, definitely. So, as I said, that 3 hours of exercise every week is what is recommended. And even then, if you don't want to go to the gym, or you don't want to do that hardcore sort of workout, you can even do yoga. Yoga is a time tested and tried, and it's like our Indian roots, and it works really well. There have actually been studies of yoga helping women who've had breast cancer to sort of they do their exercise, so it makes them aware of their body. They make sure that they're eating right. Not just that, they feel happier, they feel better, and there may be a risk reduction related to that.
So, people who have a family history, are they going to end up having breast cancer?
So yes, I would like to talk about it, but they won't get sorry. That was a wrong yes. But yeah, so when, as I said, it's a risk factor. So in breast, it is not A equals B. So it's not 100% that if you have a strong family history, or if you are BRCA1 2, or any of the other genetic mutations which are responsible for breast cancer, it's not necessary that if you have that mutation that you will get breast cancer. It is very important to understand that everything is risk associated. So usually, let's say for BRCA1 or 2, so BRCA1 breast cancer risk would be around 60 to 80%, and a little lower for BRCA2, which would be around 50 to 70%, right? But it is not 100%. No one has 100% risk of developing breast cancer. Same for if you have a mother with, say, breast cancer. So if your average risk is 3 out of 100, then if you have a mother who's got breast cancer after the age of 50, your risk becomes 5 out of 100. And then if you have a mother who had breast cancer less than 50 years of age, then your risk increases more and becomes 6 out of 100. So risk increases and risk decreases. Risk is not 100 or 0 for anyone.
Right.
So
Right.
coming to also just the main genes that are responsible and talked about are BRCA1 and 2, but there are other genes also implicated in breast cancer, such as P53, PALB2. So those are also there. And all of these genes, BRCA gene is not just breast cancer gene, you know. So I mean, it is breast cancer gene, but it also renders your risk. It increases your risk for developing some other cancers like ovarian and all of that. So if you do have a strong family history, then I really recommend that you go to a genetic counselor and have the patient who, ideally, if you have the patient who had the index cancer, get her tested. And if she is positive for any of these mutations, then the rest of the family or the first degree relatives, by first degree I mean your parent, your sibling, or your child. Okay, so just your first degree relatives can then be tested, and it moves from there. You know, not the whole family is not just taken and tested. So you check the index person, then the next sort of ring of people around them.
Yeah. So there is another question. Now there are some questions on mammograms. So how frequently should one do a mammogram, and is it after some age or age that they should start really?
Now since we've talked about hereditary or family history breast cancer risk, so let me add that as well to this. So for an average risk woman is that if you don't have any of the risk factors we've talked about, usually you start your self breast, your clinical breast examination as advised, and then after the age of 50, you can start a mammogram every 2 years. Uh, Between the ages of 40 to 50, a lot of places you'll read that you can do it after the age of 40. You sort of have to discuss it with your physician or your treating doctor and see what are the other risk factors. Are you coming in that criteria? Did you have your child after you were 30? Did you not breastfeed your child? Are you obese? You know, those are all the risk factors. So if you have one or more than one of these risk factors, then you may also choose, or your doctor may also advise you to start it before the age of 50, and say at around 40 years of age. um, in women who are at a higher risk, say in BRCA1, BRCA2, or any of the other mutations, for them, cell breast examination definitely starts between 18 to 20 years of age. The clinical breast examination should also begin around that time, around 25 years of age. And they start their screening from the age of 30 to 35. So what happens is that you have a clinical breast examination from your doctor starting from the age of 25, and then at 35 or 30 35 you start your annual mammogram and an annual MRI. The role of MRI is also fairly important in women with the increased breast cancer risk due to genetic mutations or family history. So how we usually do it is that we call them 6 monthly, and so that every 6 months they have one imaging. So they have a mammo and then an MRI, and a mammo and MRI, and every 6 months they also get examined by the doctor, which is also a good thing. So I'm saying this 35, but if in your family the breast cancer, that whoever was the other person who had the breast cancer had an early breast cancer, say if they had it at 35, then you should start screening for your cancer 10 years before that, but not before the age of 25. So if they had it at 30, you still start at 25. If they had it at 35, you still start at uh, 30 25.
Okay. Okay. So there are a couple of more questions on mammograms. So what is a regular mammogram, and what is the difference between regular and 3D mammogram?
Right. So when you say a regular mammogram, you kind of mean a 2D mammogram, was
Yeah.
what is done
Yeah.
conventional X-ray mammogram. So in that, they put your breast in two plates, and they take, usually for screening, they just do one view. But if you already have a lump or a known symptom, then we do two views. One is mediolateral and one is a craniocaudal. So they look at your breast in two views. In that, you get a 2D image. Okay, so you know this is the superior part, this is the inferior part, or whatever, upper and lower and outside and inside. And based on that, you can sort of know where your tumor is. So what happens sometimes, especially in women with dense breast on mammogram, which is they have less fatty and more duct and epithelial um, areas in the breast, so their mammo is not very clear. So what happens in those women is that sometimes you can miss something, or sometimes when breast tissue goes on top of breast tissue, it looks like um a lesion, a lump, a mass on the mammogram. So the thing is that usually earlier, patients would do this and then they would go home and then they'd be called back and would do another USG or another view to see what it is. So what happens in 3D mammo is they take these serial images. So they can so it sort of reconstructs the breast in a 3D way for them, so that they can see through they can go 1, 2, 3, 4, 5, so they can see all the sections of that lesion, and they know whether it's a lesion and or whether it is a it's just breast parenchyma folding on itself. So that is one of the main things, is that in dense breasts it is very useful, and the patient can do it in one exam. It makes it more clear when you have like a doubtful area.
Yeah. Also, a very common question that comes in is mammogram painful? A lot of women get scared of it. They always ask, is it painful?
Yes. So a mammogram is uncomfortable. And as anyone, you know that some, not just women, some people are just more susceptible to pain than others. So, you have people who are very, okay, you do a mammo, it's uncomfortable. So they do put your breast between two plates and then film it, because you need to sort of make the breast thinner so that you can see everything clearly, right? So there is a little bit of pressure that is put, and you have to pull the breast a little to see the entire breast. So it is important. There is the other option that we have right now, that is completely pain free. So even a blood test is painful, but you
Yeah.
kind of do it. So a mammogram is uncomfortable, but the degree of pain changes from person to person, and there's susceptibility to pain. However, I think the benefits at present outweigh the risks, and the discomfort, I mean, that's a personal choice,
Yeah.
but maybe you can push through
No,
it.
but what you say is right. Probably it's the best screening tool available right now with all of us.
uh, I'm still going to say self breast exam and clinical breast
Is the
exam,
best.
and yeah, first and then mammo second. But
Yeah.
yes, it is. So the problem with self breast examination is doing it every month, and even in studies they have found is that is where it kind of doesn't live up to mammo, is that women, you have to really hound them to do it every month.
Yeah.
So taking out that time for yourself, women find it hard to do. And I'm not being sexist here, but it's just, I don't know, it's in our nature or what,
Yeah.
or we are such big multitaskers. I think we should put it as one of our tasks and not put it
Yeah.
so low on the priority that it completely falls off our timetable. If you're healthy, your family is happy, and you can take care of them, and do your job and do everything properly. If you don't have health, you basically, I mean, nothing else matters.
Yeah. So we come to the next very obvious question. Someone is doing breast exam every month, and suddenly they find a lump or they find uneven breasts. What should they do?
So um, So if they are doing it every month and they found something new, so definitely approach a specialist. Okay, I mean, it doesn't have to be a breast specialist, me, but it has to be either a general physician, or even a surgeon or a gynec. A surgeon or a gynec would be able to examine your breasts well and would be able to give you more information. So once you find a lump or any symptom, and you go to a doctor, so there are three things that happen. So this is known as the triple assessment, and it is almost always the case. So the first thing is that the doctor will take your history, and this will be a very detailed history of your obstetric, which will cover all your risk factors, mainly when you had your period, how many children, breastfeeding, family history, all of that. And they will do a clinical breast examination. After doing this, if they really think that there is nothing to be concerned about, it can stop there. But in all likelihood, the second thing that will happen is imaging. So an imaging for a girl or a woman less than 30 years would likely be an ultrasound, but anyone over the age of 30 or 35, it will be a mammogram and an ultrasound if needed. And your mammo or your ultrasound gives fairly important information to your doctor. It tells them what that lump is it filled with some liquid, is it a solid lump, what to do next. So once we have that imaging in our hand, we know what the radiologist was thinking, what is their degree of suspicion, can we leave this, should we go ahead and biopsy it. So the third thing is biopsy. A biopsy can is can be done in many ways. So you have a needle biopsy, where just the small needle that is used for blood collection is used to aspirate some of the cells and examine them. Or there is a gun biopsy, which is I think the most common for me. And there you take small chunks of 18 to 22 millimeters, and you examine them under the microscope, and it gives a more clearer picture, and it gives more detail than that small needle test. And these are the two things which are usually done. If these two fail, then we may recommend an open biopsy, which is a small surgery to take out that whole lump or a part of the lump. um, yeah, so these are the three things that happen. One is clinical breast examination, imaging, and biopsy if needed.
It's alarm. Sometimes people overthink when they are doing a breast exam. It's always better to consult someone and get your doubts cleared.
Definitely, definitely. Having said that, I think, Dr. Emma, it's so important that when you're doing your first breast examination, first cell breast examination, take it with a pinch of salt. You're going to feel something. You might think, oh, this is lumpy. So maybe wait for your next cycle, examine yourself again, and always examine against the chest wall. If you feel like this, you will definitely find a duct that you're, a lobe or a duct that will feel a
Yeah.
little bit lumpy. So always examine the correct way. And and if you still think there is something, then yes, approach someone.
So, before coming for this event, I actually took up some questions from our regular audiences, and then I have one question where one of the ladies asked if my breasts hurts even when I am not in my periods, then does that mean I have breast cancer?
Well, breast pain is a slightly complicated sort of a topic. So, breast pain is of a few types. One is a cyclical mastalgia, which I think she already understands, is leading up to your period, you have an increase in breast pain, you feel a little bit of heaviness, and once you start menstruating, that goes away. That is very commonly seen in general in women, and it's not really something you worry about. But when you have non-cyclical mastalgia, that can be of two types. One is that it can be actual breast pain, or it can be a pain of the surrounding areas. It can be a little bit of chest pain. It can sometimes women even come with saying breast pain, and it could be actually an angina, which is your
Yeah.
heart attack sort of a pain. So that so having said that, no, just because you have pain in the breast, which is not changing with sorry a period, it doesn't mean that it is definitely cancer. There are other reasons, like cysts can be painful, which cysts are nothing but fluid filled sacs. They can be painful. There can be some low grade infections, especially in diabetics, that can be painful. But yes, if you do have a pain which is persistent throughout the month, you should definitely get it assessed, because we can't rule out breast cancer. We definitely should at least get an imaging and have it examined by a professional to make sure that it is nothing, and then you can sort of follow it up.
Right. So, let's come to breast cancer in men because I'm sure they must all be waiting to hear. So, what kind of symptoms will men have? How will they know? Do they do breast exam, self exam, or how is it?
Breast self exam. So as I told you, so what happens with screening, and cell breast examination is a way of screening, is that the disease should be prevalent enough. If there are going to be 100 million people and only one person is going to have it, then there is no point of
Yeah.
screening or looking for that disease. Similarly with men, like in women, say in India, the average risk is about 4%, sort of lifetime risk, and in the Western population, it's around 12%. So keeping that in mind, uh, like for men, it's the risk is like less than 1%, and even if they have a BRCA mutation, their risk increases. um, in BRCA 1 to 5%, and in BRCA 2 to about 5 to 10%. So I think for men, the important thing is to be more aware rather than actually performing a self breast examination. So if they want to, do a self breast examination, there is no harm. So in a high risk individual, in a high risk male, you can do a self breast examination. Um but in a regular male without any family history, without any genetic mutation, I don't think it is recommended, or it's going to find much. Second point is what you're looking for. You're looking for fairly similar things, but men with breast cancer very often don't notice the lump for some reason. So they will either notice an ulceration or a wound on the breast or on the nipple, or a nipple discharge. So what happens, in men, a, because of lack of awareness, and two, because of they don't have that much breast tissue. So when in a woman's breast, when the breast tumor grows, it grows within the breast, but in men it fairly quickly reaches the skin or the muscle. So they may present with slightly higher stages of disease. And even in age and stage matched disease, sometimes men actually have a poorer survival than women when it comes to breast cancer. But what they're looking for is similar things. They are looking for a lump, they're looking for nipple retraction, nipple discharge, or a wound in the near the nipple or on the breast, or lump in the axilla, which is the armpit or the neck. So fairly similar things we are looking for.
I think it's good that you touch based on that, because it's very important also to cognitively be aware of what's going on with that. So,
Yes.
I also want to touch base a little bit on recurrence. A little bit, if you could talk about, because I know it's a very common understanding that breast cancers can't be cured and they recur. But I want to understand from you, what is it really?
So when you speak of cancer, you there is no 100% cure. Okay, you are cancer free. Okay, so once you so if someone comes in early stages of disease, you do your surgery, and if they need radiation and chemotherapy, all of that, they complete their treatment, and after that they come for a follow up. So for a we call for a 6 monthly follow up is what we advise for the first 5 years, and then they can move to an annual follow up if they're doing well, or and then even after 10 years we still call them after 2 years, just come, show your face, show your breasts, and it's important. So you can never say that even after 25 years, if a woman has been cancer free, you can't say that she will never get cancer, but in life, like, you can't say that about really anything. So there are patients who have been cured of whatever, they have been treated for breast cancer, and they have gone on to live for their 25-30 years, and then died of something age related, like natural causes, or due to a heart attack, or a diabetic thing, a road traffic accident. So it is not necessary that if you've had cancer it will come back and it will kill you, but the chance is never zero, and it's something like that. So in an early breast cancer, and then operable, what I said was stage 1, the 10-year disease free survival is 85%, around 80 to 85%. So when I say that, what do I mean? What I mean is that if you have 100 people or 100 breast cancer patients, all of them who were treated, say, on 1st of January 2020, 10 years later, 85 of them will still be okay, and 15 of them would have recurred and would have maybe even passed away. So that's what I mean, is that it's always a proportion. It's the risk of recurrence and death is never zero, and but it's also not 100% that you will definitely. And it's a range. So when you have more advanced disease, there is a higher chance of recurrence, definitely.
We have a last audience question which is coming in. Angie wants to know if the incidence of breast cancer has increased over the last 5 years. Do you see an increase in people with diagnosis of breast cancer? Or
So overall, the what I would say, that what I told you was 1 in 24 is the risk factor in India. So about 5 to 10 years back, it used to be 1 in 28. So yes, with the urbanization of India, the numbers are increasing. Okay. And the numbers are increasing, and it is better. I mean, rural, there's a huge urban rural divide, because they live their healthy lifestyle, they eat fresh fruits and food, they work in the fields, or they do manual work, they get that physical exercise in. So and other factors also, they have children before the age of 30, they breastfeed them for years on end, so all of this really reduces their risk. And that creates an urban rural divide. And as in the metros, we are becoming more and more like the Western culture, and the sedentary lifestyle, and the high fat and low fiber food, the increased use of alcohol, all of this is driving the cancer numbers higher. Yes.
So, I'm so thankful to you, for coming on this platform, because this was one talk I always wanted to have. I've heard you on other platforms also, and you are absolutely brilliant. So,
Thank you.
thank you for that. And so, what are your last few words for our audience who is watching it live right now? So, we have a number of them watching it live right now, and people who will watch this repost, in the coming days. What is your last message?
um, Let me say a few things actually. One is that definitely it is so important to just be healthy and eat healthy and live healthily, not just for breast cancer but for every disease possibly known to man, from heart attacks to strokes to other kinds of cancer. It is very important to be healthy and to be exercising, and limiting our excesses that we have. And the other thing is that screening and awareness is so not talked about in India. So you have heard this talk today, tell someone else tomorrow. If you're a boy watching, then find your sister, your mom, your girlfriend, your wife, and tell them that you need to be doing this, because it's important. Breast cancer doesn't affect men just as male breast cancers, it affects them as family members and caregivers. So that is an important point.
So, for people, just the logistics for people who are watching us for the first time, you're watching us on the channel Lose Your Blues. Please stay tuned and come back again next Saturday, same time for a new speaker. And bye for now. Thank you.